Are you a woman struggling with vaginal discharge and you don't know if it is normal or abnormal? Then this video could be for you. I'm Dr. Kavipriya Soma, a GP with special interest in women's health. So, what is vaginal discharge? So, basically, just some mucus that is coming out of the vagina. It can be physiological or pathological. So, what is physiological means it can be normal, pathological is it is abnormal. So, that's the basis. So, physiologically, how should it look? Now, remember, in a reproductive age group woman, the discharge follows the menstrual cycle pattern. So, in the period following the menstrual cycle, there may not be any discharge or there can be some white discharge. During the ovulation, so that's the fertile period, the discharge becomes quite thin, watery, and clear. And post ovulation, or just before the period, it becomes white. So this is nature's way of telling you when the ovulation is happening and when it is over and getting ready for either pregnancy, or if there's no pregnancy, the body is getting ready for the next menstrual cycle. What are the pathological causes or abnormal vaginal discharge? So normal vaginal discharge can be just clear or slightly pale white in color. It should not give any foul smell, redness, itching in the vaginal area. If the color changes to yellow, green, or red, that's abnormal. One of the other symptoms that you may experience is abnormal smell or malodorous discharge. So if this is something that's happening to you, definitely seek help. Now, what are the investigations that are available to you to diagnose the problem? There are very simple tests available. It's called either a low vaginal swab or a high vaginal swab. So a low vaginal swab can be performed by yourself. Yes, you need guidance from your healthcare professional, but you can do it yourself and submit it to the lab. The results will be available to us within 3 days. It can pick up infections like yeast infection, then bacterial infection, or a sexually transmitted infection. If you are unable to perform it yourself, definitely your healthcare provider can help you with that. Then we are able to collect the samples from the upper part of the vagina, then it is called a high vaginal swab. Sometimes we may collect the sample from the cervix or the lower part of the cervix, which is called an endocervical swab. So what are the treatment options available for the discharge? First things first, abnormal vaginal discharge. Always seek advice from an appropriate healthcare professional. If it needs diagnosis through performing a vaginal swab, that needs to be done so we can treat appropriately. Try and avoid self-medication. But some of the general things that you can do is avoid scented products in the area, frequent change of menstrual products. So if you're a person who uses menstrual cups, make sure you sterilize them appropriately and change them frequently. Or if you use tampons or pads, again, change them frequently. General advice would be cotton undergarments, again, to prevent or to enhance the absorption of sweat in the local area, to prevent malodor as well. Probiotics in your diet. So if you are a person who can tolerate dairy, then dairy products would be appropriate, especially yogurt, fermented products. But if you're allergic to dairy products, then please take supplemental probiotics to balance the good and the bad bacteria in the vaginal area. To prevent sexually transmitted infections, protected sex is very important. If need be, have checks done as often as you think it is necessary to exclude or confirm. Medical management would be based on the swab results, depending on what the swab tells us. So if it is a yeast infection, then antifungals might be given. If it is a bacterial infection, appropriate antibiotics will be prescribed to you. So if you're someone struggling with these symptoms, so if you'd like to visit our website, www.athenawomensclinic.com.au, you can book an in-person or teleconsultation as well. Thank you.